what might, how might you initiate a conversation? What kind of questions would you ask a patient that's in your practice where you believe they may have some issues related to OSA? How might you initiate that conversation?
So that's actually pretty easy, because we've been thinking about that for a long time in this field. And there are many questionnaires that are very easy to print out and give patients during hygiene visits that will actually address these very points. So if you're not comfortable going in and asking somebody if they snore or if they think they have sleep apnea, which if you're not doing this all the time, it kind of comes out of the blue. So you're not going to do it. But what if you added, there's an instrument called the stop bang, where you could use a stop bang and that's an acronym for all the different things that you should look at for sleep apnea, and have them fill it out as part of their normal medical papers.
Does ADSM have one?
Yes, you could get them on the internet. I mean, everybody has them. If you go to the American Academy of Dental Sleep Medicine, they have all kinds of free things that you could print out. That's one of them. You could come up with your own questionnaire. Do you snore? Are you tired all the time? Do you wake up frequently at night? And you just add simple questions like that to their routine medical forms that they fill out when they come back for their hygiene visits.
Right.
And when they check yes or no, then that would initiate your conversation, and then we can talk about that. And
that certainly is not it's not invasive. Very easily, like we would in any health history.
Exactly. This is stuff that we should be doing anyway. Because
it's part of being thorough.
Yes, because doing part of a comprehensive exam, which we all like to do anyway as part of our practice. Even if you didn't want to treat the sleep, you should identify it and refer it to somebody who you would, just as you would if you found high blood pressure. If somebody came in and they said, oh, I'm hypertensive, or you would send them to the physician to have that treated. Right. So this is something that's also very, very much in the wheelhouse of every dental practice that they could look for.
I'll repeat, you had mentioned the American Academy of Dental Sleep Medicine has resources. So any of our listeners can go there and find those resources there.